All right, so this week we're going to look at the tissues of the tooth. So we're going to look at what is an enamel, what is a dentin, what is a cementum, which is covering the root, and what is a pulp. We're also going to look at the different functions of teeth. So incisors do something different than molars. We're going to look at what is an anatomic crown and what is an anatomic root versus clinical crown and clinical root. We're going to find out that there are teeth that have one root, two roots, and even three roots, and we're going to look at the difference between or the significance of the crown root ratio. So let's start by looking at why we have teeth. Well, the reason why we have teeth is to help us chew, right? If we didn't have teeth, we won't be able to chew our food, and if we can't chew down or break down our food into small pieces, then our digestive system would be in trouble. So we need teeth to break down food so that we can swallow and our digestive system can do the work. We also need teeth to speak. Think about people who wear full dentures. When they take out their dentures, it's hard for us to understand what they're saying because teeth play an important role with speech, with communication. So teeth are very, very important. Here is the crown, here is the root. Again, crown, root. And when you look at the crown, it's covered with enamel. So the white is enamel. When you look at the root is covered with cementum. So the yellow part could be cementum that's covering the root. Now this line right here is known as your cemento-enamel junction, or your CEJ. A junction is where two areas meet. And here, the cementum, which is covering the root, and the enamel, which is covering the crown, this is where they meet. Hence, this is the CEJ, also known as the cervical line. Now, when you look at the anatomic crown is the actual crown. It's the whole crown from here, from the cusp to where the CEJ is. So that whole thing is your anatomic crown. But clinical crown is just what you see right on top of the gum. So the gum line is right here. So we just see this part. So that's what we would call the clinical crown. But in actuality, our crown is actually from here all the way to the CEJ. So anatomical crown is the entire crown. Clinical crown is just what you can see. So if I look inside your mouth and I just see that on top, then that's what I would call the clinical crown, because that's all I can see clinically. Same thing with anatomic root. When we look at the anatomic root, the root actually starts from here where the CEJ is till the very end where the apex is. But clinically, we might say the root starts from where what we can't see. So from the gum line all the way to the bottom. So clinical crown, clinical root is what you cannot see clinically. And so again, when you see this boxed area here, that could be considered your clinical crown because that's all you can see, and everything else would be known as your clinical root. But we know the anatomic crown is actually right here, and the anatomic root is right here. So when you look at the entire dentition, you'll notice that the incisors have single rooted teeth, and then the molars could have two roots or three. And how can you remember this? Well, think about if you're anchoring something on the ceiling. Okay, so let's say you're hanging a chandelier up on your ceiling. You want it securely anchored, so you want lots of roots or lots of screws up there, right? Because then you don't want it to fall on you because of gravity, right? So same thing with this. Maxillary molars have three roots more than mandibular because of gravity. We want it to be secured more. So that's a way you can remember: three roots in the maxilla, two roots in the mandible. So three roots in maxillary teeth, or molars rather, and two in the mandibular molars. The very tip of the root is known as an apex, or it's also known as a terminal end. So the apex is at the very tip. So for example, with this tooth over here, which is the 1-7, there are one apex, two apex, three apex. So there's three roots, so the tip of each root is known as an apex or terminal end. This is your bone, and that bone is called the alveolar process. So the alveolar process is a bone that houses the teeth. And so here we see a tooth that's housed into, or that's secured into the alveolar process. And this empty space right here, if I were to take this tooth out, I would see this empty space, and that empty space is known as an alveolus. So this is where the root is anchored into the alveolus. Now we learned this last week. Maxillary teeth are the ones that you see in the upper jaw. Mandibular teeth are the ones that you see in the lower jaw. And you can see the maxillary molars have 3 roots. It has 3 roots because it needs to be more securely anchored. Root to crown ratio is an important concept. So the higher root to crown ratio, the more resistance to displacement. And let's look at what this actually means. When you look at this picture, do you see how this one has a longer root compared to tooth B, which has a shorter root? The longer the root, the better. Okay, we like long roots. This is actually the canine, and a fun fact for you, canines have the longest root. From all our teeth, canines have the longest root, and so therefore, it is more resistant to displacement. That means it won't displace, it won't move, the teeth won't shift, the teeth won't get as mobile, and you may be able to keep that tooth in your socket, in your bone, for a long period of time. So we like it when we have a longer root, because that means you have a high root to crown ratio. So the way it works is, if I were to, let's say, measure from here to here, and let's say I get 2. So imagine I'm gonna, for this, I know a tooth is not 2 centimeters, like the crown is never 2 centimeters long, but let's just hypothetically say that this is 1 centimeter, this is 2 centimeters, let's just say. And then we measure the crown, and we're like 1, 2, and maybe 3. So this could be 3 centimeters. And again, this is like just, I'm giving you a very, very basic example. I know a root is not 3 centimeters long, but this is considered a 2 to 3 ratio. 2 to 3. There's like, if we measure here, you got 1, 2, 3 equal parts, and here 1, 2, 2 equal parts. So 2 to 3 ratio is good. It's a high root to crown ratio, and that's considered the optimal. But if I were to measure this, let's say I get 1, 2, so 2 here, and same distance here, so 1, 2, so 2 again here, 1, 2, and so this is a 2 to 2, or if I cancel it out, I would get a 1 to 1 ratio, and a 1 to 1 ratio is lower than a 2 to 3 ratio. This means that this tooth over here could easily start getting shifted, could easily come out, because we don't have a long root. So we like it when we have a high root to crown ratio, when we have a higher or longer root. Okay, let's look at tooth tissue. So we have the enamel, which is the outside. We have the dentin, which is the yellow part that's on the inside. We have cementum, which you may not be able to see, but cementum is like covering the entire root. So the cementum just like outlining over here. That is your cementum. And then we have the thing in red, which is your pulp. So let's start with the enamel. The enamel is the white part that you see on the crown, and it's very thick, typically over the crown, and becomes thin as you go up into the cervical line, or where the CEJ is. And if you have thick enamel, it means it's going to look nice and white. But if you have thin enamel, then the color could be less white. It is the hardest tissue in the human body. So enamel is so hard. It's the hardest tissue in your human body. In fact, till today, I know we have fillings and stuff, but nothing can compare to the enamel. Enamel is so hard and unique. We still haven't found a material that is just as similar and as unique as enamel. Dentin is the inside, and so this is what you see here. It's usually yellow in color, and we can, over time, it can regenerate. That means over time we can get more and more dentin. So primary dentin is our original dentin, and then secondary dentin, that's right here. And what's unique about the secondary dentin is that it grows over time. We get more and more secondary dentin over time, to the point that when you become a senior and very old, the pulp might diminish. You might see very little pulp because the secondary dentin just kind of took over that, the whole tooth, that the pulp just is almost gone. So secondary dentin does get formed throughout life. And then tertiary or reparative dentin, that's this one right here. So anytime you have a cavity, to compensate, they'll make tertiary dentin to help out. It's like a compensation factor. So it's anytime there's trauma, anytime there's caries, tertiary or reparative dentin will be formed, and that's what we see here. Cementum is this thing that you see in red. It is covering the root. It is less hard than enamel or dentin. So enamel is the hardest, then comes the dentin, and then cementum. It's very thin at the cervical line, so it's very thin over here, but then cementum gets very thick at the very bottom, at the apex. And I'm going to show you this picture here. So there's actually two types of cementum. There's acellular cementum and cellular cementum. So acellular cementum is right here and it's very thin. It covers the entire root. And sometimes what happens is when we're scaling off teeth, when we're debriding, we can remove cementum, and when cementum is gone, that's it, it's gone, it's not coming back. So acellular cementum, once it's gone, it's gone. But cellular cementum, which is at the bottom, that one can actually reproduce itself. That one can actually grow. So over time, we may find that the people have a lot of cementum, cellular cementum at the bottom. So especially when you're grinding or when you're clenching, and you'll learn about this in other courses, the cellular cementum gets built to compensate for that, grinding and clenching. So how can you remember that acellular cementum is at the top and cellular cementum is at the bottom near the apex? Well, the way I remember it is cementum usually gathers over here. It's kind of like a C shape, right? Do you see like a C shape, like a sideways C? So that's how you can remember C for cellular. Or another way you can remember it is that alphabetically A comes first, hence it's going to be more at the top, and alphabetically C comes later in the alphabet, hence it will be at the bottom. So many different ways we can learn to memorize acellular and cellular cementum locations. Lastly, we have the pulp, which is right here, and the pulp is where you get feelings. So if you feel, anytime you feel any sensitivity, so if you're sensitive to cold, sensitive to hot, it's the pulp that is transmitting that message. So pulp is where all the blood supply is. The blood vessels are there, the lymph vessels are there, it's also vessels, also tissues are inside there. And the reason why we have pulp is as we said, it has nerve tissue, so we feel pain. The pulp is where we would feel the pain. There are blood vessels there, and blood vessels are great because one of the things we'll learn about as you progress through the program is that blood vessels have white blood cells. And white blood cells are really important because anytime there's infection, white blood cells will work really hard to get rid of the infection. Now let's look at the different types of teeth. So we have incisors, which are our front teeth, and in total we have 8 incisors. We have our central incisors and we have our lateral incisors, both on the max and in the mand. Then we have our canines, we then have our premolars, and we have our molars. So let's look at incisors first. So incisors is there to cut food, okay? So think about when you're eating a piece of steak. First you might use your incisors to cut it, and then you would bring the steak to the back of your teeth. So the way to remember this is incisors kind of sounds like scissors, and scissors are there to cut. So that's how you can remember incisors are used to cut. And how many incisors do we have? Well, if you look at this picture, we have 8 incisors in total, 4 on the top, 4 on the bottom. Canines, so canines, look how long the root is. The longest root, the longest teeth actually in the human dentition is most stable because it has a long root. So because it has a long root, it's very stable. It's very hard for us to lose that tooth because it will not be displaced. It won't become loose. It won't shift because it's got a long root. And the function of a canine is to hold or grasp teeth. Think about a dog. A dog will use the canine to grab its prey, right? To hold its prey. So same thing here. Canine is there to, it's known as your holding or grasping teeth. So anytime you want to grasp some food, the canines will do the job. Premolars. So we have, this is actually the maxillary first premolar, which has 2 roots, and I'll tell you a trick later on when we get to that as to how you can remember that maxillary first premolar have 2 roots and all the other premolars have 1 root. It used to be called the bicuspid because it has 2 cusps, but the reason why it's not called the bicuspid anymore is because sometimes we have seen premolars with 3 cusps, and so we just say, okay, you know what, instead of let's scratch the word bicuspid and instead let's use the word premolars. So most have 2 cusps, but because some have 3 cusps, we no longer say bicuspid. Bi means 2, and that word is not correct. So the buccal cusp, which is the outside, they hold the food, and then the food goes inside, and the lingual cusp kind of grinds the food. So it holds the food and grinds the food. And with the molars, you can see this molar here has 5 cusps or 5 round mounds. Some have 4, so it varies from 4 to 5 cusps. And their main function is to chew or grind food. So anytime you first use your incisors to tear, to cut, then your canine might be holding the food, then you go to the premolar, which grinds some more, and then you go to the molar, which grinds even more. So the molars' function are to grind food. And lastly, I want to let you know what anterior and posterior teeth mean. So anterior teeth are the ones in the front that's highlighted in blue. Posterior teeth are the ones at the back that's highlighted or colored in white. And if you look at the anterior teeth, it includes the incisors and the canines. So anterior teeth are the incisors and canines. And they have 4 surfaces and a ridge, and I'm going to show you that. So 4 surfaces. So this would be the facial surface. This would be the mesial because it's closest to the midline. This would be the distal, and then so we have 1 facial, mesial 2, distal 3, and then if I flip it, and I'm going to see if I can move the screen up slightly. Well, but right here is the lingual. Okay, so now we can see it better. So lingual is here. So 4 surfaces: lingual, facial, distal, mesial, and then it has a ridge, and this ridge right here is known as your incisal ridge. Let's look at the molars. So the molars actually, instead of having 4 surfaces, it has 5 surfaces. So let's look at this one. It has the facial or buccal, okay, buccal. It has the lingual, which is on the inside, the lingual near the tongue. It has the mesial, which is, if I flip it a little bit, this whole portion over here is the mesial. And then it has the distal, which is, it's kind of hard to see here, but this whole portion over here on the back side is the distal. And then it also has the occlusal. So the occlusal is the 5th surface. Okay, here we have the incisal, which is like a ridge. Here we have the occlusal. So to recap, posterior teeth include the premolars and molars, anterior teeth include the incisors and canines.